Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, we are so happy to have as our guest, Sandra Lee. She is a chemist and scientist. She went to the University of Michigan Graduate School, and she is one of the few female CEOs in the analytical testing industry. Sandra has a passion for chemistry and how it influences multiple aspects of our daily lives. She has worked in many scientific roles, and also she recognized the importance of uncompromising quality through chemistry, not only from a company's perspective, but also from the consumer's perspective of product safety and public health needs. So thank you so much for being our guest today, Sandra.
Hi, Ellen. Thank you for having me, and thank you for the intro.
Well, let's go back in time a little bit, and let's go to Sandra as a little girl. What made you interested in science, like I was also? So what brought you to science, and in particular, chemistry?
Well, believe it or not, I actually did not like science so much growing up, but in high school, I had this one particular teacher. And, most of the time you're like, teachers come and go, but I had one chemistry and physics teacher that really had an influence in how I studied. He was a role model for me, and he really helped me to see beyond the textbooks, like how science was in our lives daily. And that, as difficult as it was very intriguing. And so he encouraged me constantly to study, constantly to go over the hurdles, because it's not an easy thing to learn, in high school, especially when you have so many other things going on. So that's probably where it really started.
And then you continued with science in college.
Yes, I actually fell in love with chemistry when I started to work for Pfizer as an intern. I actually got the intern not because I was qualified, but probably because of my commitment to the projects that they were on. And I really was so lost because taking classes in college or in high school is so different from the industry. And it was like speaking a totally different language. And I was like, they did not teach us in lab. They did not teach us in class. So when I went, I had this amazing supervisor. I got really lucky, I would have to say, with my mentors, where she really took teaching and mentoring to heart. It wasn't just a job for her. It's not like she really got paid for it, but she really took me under her wing and taught me the basics from the beginning, how it affected our lives and how it could actually improve people's lives through medicine.
And I guess that's actually been your focus. So just tell us a little bit about NJ Labs, because that's where you are now.
Yes. So I actually had been out of the industry for a little bit, raising kids. And when I tried to enter the industry, it was really hard. And I think a lot of people can connect with this, that if you don't really have the connection, sometimes it's hard to get a job. So I actually had applied to many, many jobs, and I can't remember, but I really think I applied to NJ Labs through Craigslist, surprisingly. So when I got a call for the job, I came in and I did a little bit of research, but there was not a lot of background. There's not a lot of information about NJ Labs until I entered the company, and I realized it's family owned. It had actually been around for 85 years to this day. And it started out as a dairy lab. A milk truck had gone around and collected milk samples, ice cream samples throughout the state, and tested for bacteria to make sure it was safe for people to consume. Eventually, it moved into more environmental, and as FDA started to, crack down on the supplement industry, we moved towards testing for the supplement industry. But by the time I joined, it was on the cusp of becoming supplement-based contract laboratory for supplement companies as well as pharma. So pharmaceutical, since it was my background, I pushed heavily for that since 2015.
That's really interesting. Are they still doing testing in the supplement industry? Because I have a lot of calls for that with many people I work with, because people don't realize it's sort of said that supplements are completely unregulated, which is absolutely not true. There certainly are bad players that just jump into the market going around the requirements of the FDA and the FTC. But really, if it's a regular company that's committed to quality, they are using testing all the time.
Correct. We actually do test for supplements quite a bit. It's not as a big client base for us as the pharmaceutical side, and cosmetics is starting to come around as well. FDA is regulating supplement industry. I don't think it's as well known because people aren't talking about it as much, or they're not questioning it, but the supplement industry is responsible. If you own the brand, you're responsible absolutely, from where the raw materials being imported from, the company that you're purchasing from, all the way down to manufacturing, to testing, to labeling, packaging, making sure it's being distributed and stored and maintained properly, and stability study, expiration dates. People always wonder, how do they determine that? But they are responsible, and FDA is regulating it. It's just not as transparent probably as the pharmaceutical industry, because of the complaints are handled differently, I think. And people are not speaking up when they are buying supplements and they have adverse reactions. They're not speaking up for themselves. They need advocates. They need to work together as, consumers and report it.
Well, that's really exactly true. And thank you for sharing that. So as you move forward, our topic for today, came up because of all of us dealing with this pandemic and COVID, which hopefully is on its way out for now. Let's keep our fingers crossed. But they are talking about, I think that really elevated, as everyone can relate to, the interest in terms of at-home test kits. I mean, our own government just sent out millions of at-home test kits to everybody who asked for one. So that's like a new thing that came up in terms of awareness.
Yes, I think with the pandemic, it kind of put a spotlight on laboratories and manufacturers and these home kits that people are starting to use. It seems like it's been around for a while for different things, drug screens and test kits like that. But COVID, for example, it started out with you have to go to a facility to get tested. Now it's moved into more versatile. You can have it at home. But I think a lot of these test kits that are created, keep in mind, science is constantly about improving and studying. There's definitely principles and concepts that don't change. Like, everyone's heard about these test kits, rapid kits versus PCR kits. What's the difference?
Wait, not everybody's heard about it. You're a scientist. So you tell us. Of course, they might have heard it briefly, but you explain the difference to us, because that's an interesting point.
So, for example, if you're buying a vehicle, everyone's at one point thought about purchasing a vehicle. But when you're buying a car, you go to different dealerships. And when you go to different dealerships, there's different price points and different types of luxury cars and the quality that's put in. So one car may be much more expensive due to the features or the amount of engineering or the work that they put in to develop that car, versus another vehicle, which is more for people with a lower budget. It's the same thing with testing. There's different quality levels. Rapid kits, the faster you get results, obviously it takes less time to give you results, but the faster it is, the lesser quality it typically has, right, in a test kit. So rapid kits tend to have less quality than a PCR kit, PCR testing, which does take longer. The techniques are different. So I'm not a doctor. I don't work in clinicals, and we don't test for COVID, but the science behind it is very similar. The technique for rapid kits, usually what happens is it's on the spot, and the shorter it takes, there's a high margin for error. So that's why you hear people say, hey, it's not as accurate as PCR. So even if it's a negative on your rapid test, you could still be positive for COVID by PCR testing, because it's a different type of technique. And what they're doing is amplifying the DNA to see if you have COVID virus in your system. So as much as kits are becoming more and more common to everybody, keep in mind that they're not always perfect.
Well, of course, nothing's perfect, but yet it's very interesting that I know I called that number, whatever number it was, testkit.gov, I believe it was, and they actually mailed 2 test kits. Each of them had 2 tests in it for free. So it's great. I mean, thank God I don't need them, but it's a wonderful thing to have. And you're saying they're okay, but they have more limited accuracy. Here's something I really wonder about. I did have before I felt ill. I did a COVID at-home test. I got a positive. Thank God I didn't get that ill because I have all my natural remedies here. But good. I'm here in Florida, and we had something available that was called monoclonal antibodies, which was set up for free by the state, and we can just go there. And I did go. I got it. I thought it was an amazing treatment. I was there with well over 100 different participants who all had gone. It's just open to the public. And every single person there felt so much better after the 1 hour that you had to wait to see if you would get dizzy or any kind of untoward reaction. Everyone felt better. And yet the next day, the U.S. government decided to pull the licenses for these monoclonal antibodies. And the reason they gave, which in my opinion is bogus, was that, well, it doesn't work as well for the Omicron as it used to work for the Delta. However, when you do that test, and this is a question for you, do any of these tests tell you if you have Omicron or Delta or any of the other varieties?
Again, I just want to say that we don't work with the clinical portion. So I don't test for COVID. We test mostly supplements and medications. However, in the technique for PCR testing, there are ways to detect specifically which strain it is, because at that level, these strains do look different. So there are ways to find them and to detect them uniquely.
Okay, there are ways, but I bet that at-home test isn't doing that.
No, the rapid kits actually do not detect Omicron. You have to do the PCR testing.
Well, that's
it may
really
change later on. Yeah, it may change later on. But as of today, from what I hear in talking to different scientists in laboratories, it's PCR testing is the way to go to detect if you actually have Omicron, because that's
or a
DNA
variant.
based.
Okay, that's really interesting. So all the more reason why I have no idea why the government pulled that fantastic therapy that everybody that I was with, and thousands of people all around Florida actually got much better immediately. And then the next day they decided to pull the licensing on it. I don't like that. But anyway, so now you are involved in because of this concept, people are more familiar with at-home testing. So I know you are involved with other kinds of at-home testing. And we're here on, and I'll just remind our listeners that you are listening to Herbal Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse. And today my guest is Sandra Lee, and she is an analytical testing expert with NJ Labs. So you can also listen to this again at another time or find her from the links that we have on the archive of this show. So here's one, because we are broadcasting out of our studios right in Garden City, New York, which is a hotbed for Lyme disease. Yes. So this is particularly interesting that you're going to share with us. There's an important test kit that you can have on hand in terms of a tick test. So tell us about that.
So this tick test is actually a little different from what people are used to seeing with COVID. It's not an actual test that you do yourself. It's a kit because most people, when you find a tick on your body or your pet, they kind of panic. They don't know what to do. Even if there are instructions on a website, they may not have the proper tools on hand in order to store these ticks and mail it to us. So basically what it is a simple kit that allows you to store your tick if you find one on your body or on your pet or your kids or anybody else. And you can put it in this Ziploc bag because whether it's alive or dead, it doesn't matter because we're extracting the DNA, the blood from the tick to amplify and to try to detect the different types of diseases that they could pass on to other people and other animals. So it's because a lot of people don't know how to maintain it or store it properly. We provide the tools. It's a little baggie with the cotton that you're supposed to moisten with. Because what we do, it's as disgusting as it is, it's on our website, a video of how they actually cut the tick's head off to extract the DNA. So it allows it to stay moist a little bit, whether it's dead or alive. It makes it easier for us to test on the tick. And it has a prepaid stamped envelope, and it has a container and tweezers for you to grab the tick and put it in there and mail it to us. So it makes it very easy and simple. We do the testing. You do not do the testing because we have a lot of controls in our laboratory. As it is even just a small portion of our business, we ensure that the equipment that we use, the training that we have, the controls to make sure there's no false positives or negatives put in place is all done in our laboratory.
So how does that work? Someone would actually get this test kit to have on hand, right? Because by the time you get a tick bite, you can't wait and get the test and order it because you can't let the tick sit there.
Correct. So we have two ways of doing it. You can have the kit to carry with you if you're hiking or you're going camping to make it easier. Or you can go on our website, testticks.com, and it has instructions step by step if you don't have the kit on you to actually send the tick to us. A lot of people actually stop by and drop it off. There are ways to have the tick put in a little baggie or a little container with a moist cotton swab and send it to us. There's a form to fill out, but the kit just makes it so much easier for somebody. And we encourage people to actually just have one on them in case they need it in the future because it doesn't expire.
So I've done this.
It doesn't go bad.
Because I'm a hiker. I'm an herbalist. And I do food foraging where we go out in the woods. We actually gather, especially right in that area in Long Island and all over the country, wild, edible, and medicinal plants. So I spend a lot of time out there. And so, of course, there are ticks. And the few that I have found on me, I've actually gone to the doctor and they have removed them and sent them to a lab. And why would you want the tick tested? What would be the advantage of getting that tick tested?
So a lot of times, even if you get bitten by one, you don't know if it's carrying any type of diseases. Different ticks actually carry different. Not all ticks carry Lyme's disease and can pass it on to another mammal. Different ticks carry different diseases, and you can get very sick, and it could limit your functionality, and it could be very long term. It's not something like the flu or the cold where you let the virus go through your body and you recover. It could carry on for months and years, and it could really hurt you. You get fatigued, you can get dizzy, you can get fevers and chills and sweats and headaches and loss of appetite and nausea. It's really uncomfortable. And in certain ticks, they carry some incredibly deadly diseases that could, especially if you have compromised immune system, could kill you in the end. So it's really important to make sure that tick is not passing on potential diseases to you or to your family or to your pets. So we highly encourage people to, especially if you're constantly hiking and out in the wilderness, to protect you and your family, to have it tested because you just never know.
Yeah, it is better to get it tested. Now, if you find out that the tick, what would you be looking for? What would you be testing the tick for?
So we test the tick. We actually identify the tick first to make sure that we apply the appropriate controls to the tick.
Okay, so that's really important because there are different species of ticks. Those little teeny ones that are supposedly the most dangerous, that they are called deer ticks, and they're really hard to see. They're like a speck versus the dog tick, which is a much bigger kind of tick.
Yeah. So we actually we look for 7 different types of diseases that these ticks can pass on, depending on what they are, right? There are other rare diseases that other ticks can carry, but we don't test for them just because we found out through CDC to find the controls for them were very dangerous to handle. And I also want to keep my staff safe. I don't want them handling certain chemicals or toxins or controls that could harm them as well. Plus, there's not enough sort of like published journals on some of these diseases because they're really, really rare to find. But there are 7 very common ones, and Lyme is the biggest one that people find. You may have heard of babesiosis, Rocky Mountain spotted fever, things like that. And we do test for it. And our website actually talks about each one and what kind of symptoms you may get if you were infected.
What is that? Let's throw out that website so people can keep that, because everybody gets bit by ticks in our area.
Yeah, testticks.com.
Testticks.
Yes, testticks.com, or you can go to njlabs.com. On the upper right-hand side of the website, there is a link that takes you directly to it.
Oh, that's really useful.
Yeah. Yes, we have pictures, we have videos. It's because people are visual and it's hard to just hear or to read about it. So we think it's really important to share the pictures as well. So we talk about different types of symptoms, how long it may take those symptoms to show up, because you may be infected and not even know. So that's another reason why it's so important to make sure that these ticks get tested.
It's so amazing that, so much could be done. And what's good is sort of to know as soon as possible, because if you find out, okay, so let's ask you, if you test whatever tick has been sent to you and you find that there is none of these organisms that you're looking for, that means what? Versus if you find there are certain organisms.
If we don't detect any of these organisms or the bacteria that could cause the infection, it's not always 100%, because keep in mind, science is limited. We have limitations too, but we are very confident in the accuracy and the sensitivity of the method. If it's not detected, most likely, you have not been infected, or you haven't had it in your system long enough for you to have the infection show up. So we don't test the blood or the pets. We just test the ticks. It means that the tick most likely does not carry the pathogen that could get you sick. If it is positive, it means it did carry it. However, it doesn't mean for sure it's been passed on to you or to your pet. So that's why we always recommend to go get tests, go see your doctor, your primary care physician or urgent care, and make sure, especially if you have symptoms, make sure that they could draw blood and send your blood in for testing, for additional testing. So we always recommend medical doctor to oversee this.
So now what they recommend, if they, even sometimes just if you've gotten bit and they haven't even verified that the tick that bit you has any kind of possible disease-causing microorganisms, they often say, you know what, start on an antibiotic immediately, such as doxycycline, because it does take a few days till you mail this thing in and you guys have to analyze it. Like, what is that lead time there?
Our lead time right now is actually under 2 days, 24 hours. There are ways to have us to, people do call us in advance. We're really worried our child was bit. He's very young. Is there any way you can rush the testing? So the shortest lead time is 24 hours. But depending on how much, right now it's not tick season. So if we get a tick, we turn it around really quickly. If it starts to build up, it could take 3, 4, 5 days.
Especially in the middle of the summer when everybody's out hiking. But what about, then there's mailing time. It doesn't just suddenly appear in your lab.
Correct. So mailing time could take a couple days. And then as soon as we get it, we log it in and it's already gone to the microbiology laboratory. So we're fairly quick in getting it to once it's in the facility, but people can send it by UPS or drop it off. If you don't have the kit, you can put it in a Ziploc bag or container and drop it off. You can drive by. We are accepting visitors to come and drop off the sample themselves, especially if they need a faster turnaround time and they don't want to wait. Right.
Well, that would only be if they're near your facility.
Right. But even if you mail it in, it only takes a few days to get to us. We've had samples come from California and out west, and it usually only takes a few days. I understand with COVID and the pandemic and the mail system slowing down, so people will UPS or FedEx it to us.
Okay, so once somebody gets a tick, then they would have this kit, and they should have it on hand, because it certainly would be too long a lead time to then order the kit to send it in. Although now, of course, like I said, when I've gone in the past, the doctors, when they took the tick off, or I did what you said, like collect the tick myself. And perhaps you can share some good techniques for doing that so you don't break the head off under your skin. And I would bring it to the doctor, or like you said, the walk-in clinic, and they would send it in. So I imagine they sent it to your lab or a similar lab that then does the testing.
Yes. So anywhere you are, if you're not in a local region, it does take time to mail it in. All the labs do try to turn it around as fast as they receive it. Unfortunately, we can't control the post office, but you can guarantee by UPS tracking or FedEx tracking. For removing the tick, we definitely have videos online because it can be a little scary. It freaks me out. I don't know about anyone else, but it freaks me out. So I know sometimes people are like, oh, if we lose the head, it's okay as long as you can get most of it out and to us. Don't freak out so much because we can still extract the DNA. We definitely prefer it intact, but please use tweezers. Try not to tug too hard. And because they do kind of latch onto your skin. And one of the things that I found interesting, and it's also on the CDC site, is that when a tick bites you, sometimes they kind of numb you a little bit. So that's why some people don't even notice that they were bit. So it's very important to check your entire body and then your entire pet to make sure there's no tick on them or on you.
I know they really create so much havoc that I know people, more than one, who have just given up with walking in the woods. When people come with us on these foraging expeditions, what we do is we always go somewhere where there are wide paths. So you really can always stay in the middle of a path where you're less likely to brush against any plant material. And, I honor people who choose to do that. So I want to thank you so much, Sandra Lee. That was a very interesting show. And people can look for more at testticks.com so that they educate themselves and have these home testing kits available sooner rather than later.
Thank you so much for having me.
And thank you, listeners, for tuning in to Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.